Autophagia is defined as behavior in which an individual compulsively bites, chews, or eats parts of their own body. It is a rare and often disturbing condition that may occur in the context of psychiatric, neurological, or developmental disorders. Autophagia is considered a form of self-injurious behavior, SIB, and can vary from mild behaviors like nail biting to severe tissue damage. This lecture will provide an in-depth understanding of autophagia, covering its etiology, clinical features, associated disorders, diagnostic challenges, treatment approaches, and case examples. Classification and definitions. Autophagia is a subtype of self-injurious behavior, SIB. It can range from minor, repetitive behaviors, e.g., lip or cheek biting, to severe forms such as biting fingers, arms, or even auto-amputation. It may occur voluntarily, compulsively, or impulsively, depending on the underlying cause. Not classified as a distinct disorder in DSM-5, but may appear as a symptom in several psychiatric conditions. Epidemiology. Autophagia is rare, and its exact prevalence is unknown. Most often reported in individuals with intellectual disabilities, autism spectrum disorders, schizophrenia, or severe anxiety. Can occur in both children and adults. Frequently underreported due to stigma or lack of awareness. Etiology and risk factors. Autophagia is considered multifactorial in origin. Contributing factors include psychiatric disorders, schizophrenia, OCD, borderline personality disorder, neurodevelopmental disorders, autism spectrum disorder, intellectual disability, neurological conditions, traumatic brain injury, epilepsy, neurodegenerative diseases, genetic syndromes, e.g., Lesch-Nyhan syndrome, environmental and psychosocial stressors, history of trauma or neglect, sensory-seeking behavior or response to pain anxiety. Clinical features. Autophagia may present in a variety of forms: repetitive biting of nails, lips, cheeks, or tongue, chewing or biting of hands, arms, or fingers, sometimes causing open wounds or infection. Severe forms may involve attempts at auto-amputation, presence of scars, calluses, or wounds from repeated injury. May be accompanied by other signs of self-injury, e.g., head banging, scratching. May be ritualistic, impulsive, or compulsive depending on the underlying diagnosis. Associated conditions: schizophrenia, particularly with command hallucinations, obsessive-compulsive disorder, OCD, borderline personality disorder, autism spectrum disorder, intellectual disability, post-traumatic stress disorder, PTSD, Lesch-Nyhan syndrome, major depressive disorder with psychotic features. Diagnosis and evaluation. A thorough diagnostic process includes comprehensive psychiatric evaluation, detailed history of self-injurious behavior, neurological examination and brain imaging if indicated, cognitive assessment for intellectual or developmental disabilities, ruling out dermatological or pain-inducing medical conditions, functional analysis of behavior, especially in developmental settings, differential diagnosis, non-suicidal self-injury, NSSI, dermatillomania, skin-picking disorder, trichotillomania, hair-pulling disorder, Munchausen syndrome, factitious disorder imposed on self, neuropathic itching or paresthesia, substance-induced self-injury. Treatment approaches: 1. Psychotherapy, cognitive behavioral therapy, CBT, with emphasis on impulse control. Dialectical behavior therapy, DBT, particularly for borderline personality disorder. Applied behavior analysis, ABA, in patients with autism or intellectual disability. 2. Pharmacotherapy, SSRIs for co-occurring OCD, depression, or anxiety. Antipsychotics in cases involving psychosis or severe aggression. Mood stabilizers for impulsivity and emotional dysregulation. Sedative agents or beta blockers in select neurological conditions. 3. Behavioral and environmental interventions, sensory substitution or redirection techniques, protective gear or gloves to prevent injury, environmental enrichment and reduction of stresses. 4. Multidisciplinary management, involvement of psychiatry, neurology, psychology, occupational therapy, and nursing. Family education and training, prognosis. Prognosis depends on the underlying condition, severity of behavior, and access to treatment. Some individuals achieve significant improvement with behavioral and pharmacological intervention. However, in cases of severe neurodevelopmental disorders, autophagia may be chronic and require long-term care and supervision. Case example. Case: a 17-year-old male with autism and moderate intellectual disability presents with recurrent biting of his hand, leading to bleeding and scarring. He is nonverbal and exhibits this behavior primarily during periods of overstimulation or anxiety. A functional behavior analysis identified that the self-biting served as a coping mechanism for stress. Intervention included sensory integration therapy, a behavior modification plan using reinforcement, and the use of protective gloves. With these interventions and low-dose risperidone, the frequency and severity of the behavior reduced over 3 months. Summary: autophagia is a rare but serious form of self-injurious behavior that may signify underlying psychiatric or neurodevelopmental pathology. Timely recognition, comprehensive assessment, and a multidisciplinary treatment approach are key to managing this complex condition. Due to its potential for severe physical harm, clinical vigilance and long-term follow-up are essential.